Living with chronic pain can be one of the hardest things people have to do. Chronic pain can be downright difficult, not only physically, but emotionally as well. Write in the comments, by the way, if you are dealing with chronic pain or if someone you know is dealing with chronic pain. I want you to pull out a paper and pencil because I'm going to give you a long list, not too long, but a list of potential treatments that just might help you and people you love if you're dealing with chronic pain. Let's jump right in, guys. Okay, one or two modalities that I absolutely love are PT and OT, physical therapy and occupational therapy. Physical therapy often helps us strengthen our muscles and strengthen our body. Occupational therapy sort of serves as an adjunct in many ways to PT for many patients, helping us be able to carry out and sort of conduct our daily tasks. Now, I should mention that the treatments I'm mentioning are not necessarily right for everyone, but they could be right for you, so talk to your doctor. Also, acupuncture may be something that is right for you. I have many patients that are getting acupuncture with great results. I'm an osteopathic physician. I'm a DO. So, of course, I love OMT or osteopathic manipulative therapy. I've done videos on this. I have a demonstration video that I've done. You guys should check out OMT, also called OMM. Just go to Doctors That Do. That's the Osteopathic Association's website. You can check it out to learn more about OMT and how that can be a really great modality for chronic pain. Also, things like heat and ice. Very, very simple things. Of course, you want to get your doctor's approval to be able to use these with chronic pain. But heat and ice, or heat or ice, might be right for you. You got to take precautions when you're using either one or both, right? Because they can potentially damage the skin and the tissues if not used correctly, but that can be a great modality. I have a number of other suggestions for you, so don't go anywhere. I do want to pop in and let you know that if you're dealing with chronic pain, you're not alone. About 25% of the population struggles and deals with chronic pain. And when we talk about chronic pain, we're talking about pain that is not short-lived. We're talking about pain that lasts for months to years. And it can be due to a number of things. It can be due to an underlying illness. It can be due to an underlying disease or condition. It can be due to an underlying or an old injury. Sometimes chronic pain can happen for no reason. But some people who have chronic pain are patients with conditions like rheumatoid arthritis or lupus, or they might have cancer, or they might deal with severe migraines, or some people with chronic pain have low back pain or knee pain, whether it's due to arthritis or other conditions that's dealing with their musculoskeletal system. Chronic pain, things like fibromyalgia is a chronic pain condition. There are plenty others, guys. Those are just some, but suffice it to say, many people struggle. Okay, so let's go back to potential treatments, all right? Now, of course, there are medications. You notice I didn't mention that first because it's not always, medications are not always the best and the first line things that we use, but know that there are great medications for pain, and they come in different forms. So we don't just have pill medications for pain. I want you to understand, of course we do, and there are many different types of pill medications for pain, some that are opioids, some that are nerve pain medications, some that are non-steroidal anti-inflammatories, etc. But we also have topical medications for pain, medications that you literally apply to your skin, whether it's in the form of patches or whether it's in the form of creams. There are some that are even over the counter. But in addition to that, we have injection forms of pain medications, whether that's getting a steroid injection or getting nerve blocks or things like that. There are injections that can be used. And there are other sort of forms as well, not just oral, topical, and injection. There's other forms too. So keep in mind that if there's a certain type of pain medication that is not right for you, that you don't want to take, but pain medications may be right for you, there are other types. Talk with your doctor about this. And by the way, I should say, talk to your doctor about all of this. I'm not telling you which modalities work for you. I'm giving you ideas about the different modalities that there are. This is not an all-exhaustive list, but it's a pretty good list to give you some ideas of how to deal with your chronic pain. Let's keep going on, okay? TENS units. TENS units can be pretty awesome for the right patient. TENS units basically use electrical impulses to kind of help relieve pain. This can be something that might be good for you depending on the pain that you're having and what you've tried, what your underlying conditions are. Then there's a group of sort of therapy type modalities that I love. And not just therapy, right? Other types of modalities as well that don't fit into the buckets that we've talked about already. So things like biofeedback can be amazing. Hypnotherapy or hypnosis can be really awesome for some people. I've had a number of people quit smoking by using hypnosis. Hypnosis might work for chronic pain for you or for other people that you know. Also, meditation and mindfulness. We're hearing a lot about the importance of meditation and mindfulness, but guys, it is not fake or false. It is very real and very potentially good. So if you've not explored meditation and mindfulness, that is something I think you should take a look into. I mentioned acupuncture. I talked about osteopathic manipulative therapy. Also, a couple of things that I think can be really great, especially for like chronic pain conditions like fibromyalgia, other things like Tai Chi and yoga. Graded exercises can be great for a lot of patients, not just those with fibro. So make sure that you're checking that out, or even like pool workouts and pool exercises. For many of my patients with joints that are really painful or they've got other things going on, sometimes a pool, sort of walking a pool, can be an excellent way for them to exercise. So keep that in mind as well. A few others that I love, okay, and that you might not have thought about. I always say that animals make me so happy, like in particular dogs and pandas. Me so happy. There is something called pet therapy. That is right. Pet therapy can be amazing for some people. Also, music therapy. Therapy can come in different forms. So, remember to sort of think out of the box and think out of the box with your doctor when you're thinking about, okay, what could be right for me? Pet therapy can be amazing. Music therapy. And then, of course, one of the suggestions that I almost recommend almost every patient that I see in the office, and that is what we call cognitive behavioral therapy. That is, say, talking to a therapist. And you say, well, I'm dealing with chronic pain. I'm not. Why are you sending me to a therapist, or why are you saying it might be helpful? You have to remember, and we do remember, that chronic pain is tough. It is hard living with pain. Any of you watching out there who has chronic pain or has someone in your life who has chronic pain, you know just how hard it is. It affects every aspect of your life. It can lead to things like problems sleeping, depression, anxiety, interpersonal relationship issues, self-esteem issues. It can affect your sex life, your intimacy life, your activities that you enjoy doing. So many different things. And oftentimes, I think cognitive behavioral therapy, talking to a therapist, can be very, very important for a lot of people who are dealing with chronic pain. Guys, these are a number of suggestions, but it's still not the full list of suggestions or full list of things that fully exist out there. But I hope this is a good start for you for talking to your doctor about what might be good for you. I'd like it if you could write in the comments what you use, what you do for your chronic pain, what chronic pain you have and why, and then what you do for it, what's been helpful. I ask you to write in the comments because oftentimes what you say helps other people in your situation. Guys, remember, this is not a substitute for medical advice. You got to talk to your doctor. As much as I might wish I were your doctor, I am not. So make sure you talk to your doctor. Please share this video with others who could possibly benefit from it. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on Facebook. Please like and follow my page. For those of you who send stars, I respond personally. Also consider joining my subscription groups for exclusive content. Also on YouTube, please subscribe to my channel, click the little bell for updates, and check out drjencaudle.com for my daily health tips. Guys, I'm Dr. Jen. I'll see you soon.